Let's talk about one of the newest thyroid meds to become available to hit the market. This one is called Adthyza. And Adthyza is a natural desiccated thyroid. It's an NDT for short. And yes, being an NDT, it is derived from porcine thyroid. And it also comes in the typical dosage of T3 and T4, roughly 9 micrograms slash 38 micrograms. Given that this NDT market is already saturated with the likes of Armor Thyroid, West Thyroid, Nature Thyroid, NP Thyroid, why would a company create another one? Not quite sure. But similarly to the others, its claim to fame is that it's a porcine NDT. It's a combination of T3, T4. This company also claims that they are pretty much additive free. So, Adthyza's big claim to fame as opposed to the other NDTs, is that it's supposedly free of these fillers, these excipients. Now, if you aren't familiar with excipients, fillers, essentially additives. Purportedly, the other NDTs may have trace amounts of these, and thus, if you have patients who have concerns or sensitivities, Adthyza actually may be a better option. So let's look at the chart right here. Let's look at this table. So these are the Adthyza doses, and the recommended starting dose is 32. That's essentially equivalent to saying you're doing 30 milligrams of NP, 30 of Armor, 30 of other desiccateds. Now, typically, when we've treated patients in the past, historically, we find that 60 milligrams of an NDT is pretty standard, pretty safe to start most patients with. And thus, with Adthyza, it would be 65. So their dosage is just slightly, a little bit different, but per capita, that would be the same. So essentially, if you had 60 milligrams of Armor and you had 65 of Adthyza, you're still technically doing 38 micrograms of T4 and 9 micrograms of T3. One thing that I appreciate that Adthyza is trying to do is have transparency with the actual quality of the drug, with it having exactly what it says is going to happen in it. Especially given in this drug climate in which, as of the last few years, inconsistencies have been a problem in terms of subpotent dosing, underdosing of drugs. So one thing you can do with Adthyza on their patient website, you can actually go here and enter in the lot number of the drug, and then you can look it up, and they'll give you transparency into the actual drug itself. It'll let you know that the drug is actually what the drug says the drug has inside of the drug. We haven't used this drug yet in any patients, given that it's relatively new and that historically I like to be precise about dosage. So I tend to use the compound pharmacies where I can actually tinker with and create customized specific dosages. But this may be a good option for patients. Let's say they're curious about trying an NDT. They might be a good candidate for NDT, given their symptoms, given their blood work, but they may have some hesitancy given that they may have sensitivities to some of the excipients. May also be a good candidate if the patient has tried T4 monotherapy, which I'm not a big fan of anyway, because I think most people do best when they have both hormone deficiencies addressed where needed. But besides that, I think overall this would probably be a good drug to add to the marketplace. And after we get some experience using it with some folks, we may report back on it to give some testimonies on it.